Welcome to the Mama Stay Fit Pregnancy Week by Week update. We are now in week 37, so the baby can come at any moment. Any now.
Day.
And I usually find that this phase of pregnancy is the hardest mentally because the baby can come at any moment, and that can last for 5 weeks. So we're going to break down what to expect with your baby, what might be going on with you, and then I'm going to be sharing how I'm feeling in my 37th week of pregnancy. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and currently pregnant with baby number 4, and I am 37 weeks pregnant, so I'm going to be sharing how I am feeling in this final stretch of my pregnancy.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife, and I'm a mom of 3, and I'll be discussing what's happening with baby.
So what is going on with baby in week 37 of pregnancy?
So a lot of people think 37 weeks, your baby is term, can be born any day now, so they might as well just come at 37 weeks. But there are still a lot of things happening in the 37th week that if baby could stay in there and cook a little bit longer, it would be ideal. But at 37 weeks, baby is the size of a pound puppy. If you remember those like stuffed animal pound puppies, I think Gina and I had like a million of them as kids. But if you have no idea what a pound puppy is, a Swiss chard, maybe that resonates with you more. Some people said romaine lettuce and some people said cantaloupe, but we were a romaine lettuce last week, so it can't be the same. Like a bigger romaine lettuce at this time. But literally any day now, baby could come. But 37 weeks is what we would consider early term. So you're still term, like if baby was born, they would likely be fine, but you're still on the earlier side. So there are still some increased risks compared to a baby that's born at like 39 weeks. Their lungs are still developing. They're still developing that surfactant, which is like that lubrication for the lungs to be able to expand a lot easier and be able to exchange that gas exchange of oxygen and carbon dioxide. So we want those lungs to be developed a little bit more if we can. About 26% of births occur between 37 and 38 weeks. So not a ton of people are having their babies in the 37th and 38 weeks, but maybe
you're saying there's a chance.
There is a chance. There's still a 1 in 4 chance almost that you have your baby between 37 and 38 weeks. Other things that baby is doing, though, in the 37th week, other than developing those lungs and making that surfactant, is they're also working on their coordination. So they're able to like use their hands a little bit more finely than they were before, where it was like more like bigger movements, but maybe now they're able to like grasp a little bit better than they were before. So they might be able to grasp their umbilical cord and squeeze it a little bit better than they were, which is not ideal, but they do that quite often. If baby was not head down before, most of these babies by 37 weeks are head down at this point. But if baby isn't head down by 37 weeks and your provider doesn't do breech vaginal deliveries, this may be when they're exploring that ECV or external cephalic version option. If your baby is still breech at 37 weeks, we have a video on all of the different exercises you can do and how to explore your different options with your provider, and we'll link those down below. That's really it with baby. Baby's just continuing to grow. That amniotic fluid has started to decrease now that we're at 37 weeks. So you might notice that your belly isn't really growing as much in these final weeks because baby is getting bigger, but the amniotic fluid is going down. Some people notice a lot of like a bigger belly. Some people don't, but just person dependent. But for you, how are you doing? Other than incredibly pregnant and all of the same discoveries of pregnancy along with the symptoms. But you might start noticing different things in this 37th week. You might start noticing more spotting or that mucus plug coming out a little bit more, especially now that your terms, if you're having Braxton Hicks as well, you might start noticing a little bit more discharge. If you start noticing that the contractions or the Braxton Hicks are increasing in frequency, intensity, and they're getting closer and closer together over time, that would be an indicator that this may be not Braxton Hicks. It's not practice labor. It is true labor. And that would be a reason to like start noticing it. And maybe if you're giving birth at home, notify your birth team, as well as maybe like reaching out to your provider. Other signs of labor that we could be on the lookout for other than contractions is if your water breaks. If you feel a big gush of fluid, please take note of the time and the color and any odor of it. So taco, the time, the amount, the color, and the odor, as well as determining whether or not you're going to go into the hospital. Are you having contractions? Are you not having contractions? And kind of discussing the risks and benefits with your partner as well as your providers on what to do for that. If you're having any bleeding other than spotting, so if it's like a heavy bleed where it's like very watery and running down your legs, that would be a reason to think about going into the hospital as well to be assessed for maybe this is labor or maybe something else is going on. And then you should still feel your baby move even at 37 weeks and during labor. Baby should still be moving throughout labor and at the end of your pregnancy. It may be slightly different movements than you were feeling before, but if you're not feeling those movements, that would be another reason to go in and get checked out. And if you're just really confused, you're feeling a lot of cramping or something going on and it's first baby or even fourth baby and you're like, is this labor or is it not? You can always go in and be assessed and they'll tell you whether or not you're in labor and will either admit you or just send you home. That's really the worst that could happen is they just send you home. Are there signs, though, that labor is coming? A lot of people ask, like, well, how do I know labor is coming? Like, how do I prepare for it? Some people feel nothing. Some people really swear by diarrhea, like clearing out the path, nausea, so like you're not wanting to eat as much. Those are like very common things that people will report they felt prior to labor starting. So you might feel signs that labor is coming or impending, and you might just wake up in labor. Everyone's kind of different. But it's important to note, just because you don't feel any signs that labor is coming doesn't mean that like labor is never going to come. Like some people have these impending signs of like diarrhea, nausea, nesting, or even like bloody show. Some people have nothing and they just wake up in labor or just feel it randomly go into labor throughout the day. So,
which is me. I feel nothing before I go into labor.
yeah. I had some strong in like back pain and nesting. Gina has nothing. Just
Surprise.
wakes up. Surprise, there's a baby. Other things, though, other than how you're feeling physically in the 37th week is emotions. Big emotions once you hit term because you're like literally any second baby could come. Any second. And these can be hard to navigate because it's like the anxiety as well as the excitement of like welcoming this new baby into your home, but you don't know when it's going to happen. So it's like that like anticipation can almost be very overwhelming. And then you have like 49 people probably texting you every day. Is the baby here? Are you in labor? Any signs of labor? Which good intentions because like everyone's excited for this baby, but like I think you would text them when the baby was here. I think that you would include them. And if you wouldn't, maybe they shouldn't be texting you. One of the tests that you might be offered at your 37 or 38-week appointment for your prenatal visit is the GBS swab or the group beta strep swab. This is a swab that they'll like go from your vagina down to your rectum and they send it off. It takes 48 hours to come back. And this is testing for a bacteria called group beta strep. This is a normal flora bacteria that's within most of our bodies, a lot of our bodies. But during pregnancy, this bacteria can overgrowth just due to the changes within our body. And then this can transfer down to like our vagina and our rectum. And this is not usually a problem for us. Some people might report increased urinary tract infections, but most people have no signs that they have this overgrowth of GBS. But during labor, if you have a vaginal delivery, there is a risk that that GBS can transfer or be transmitted to baby during the process. It's not a super high risk, but it is a chance. And if that GBS does transfer to baby, there is a risk associated that baby could then develop a GBS infection. Because their immune system is not fully developed, if they do get this infection, this could progress pretty quickly to a pretty severe infection that has a lot of complications. The risk associated with getting that infection if you are GBS positive is fairly low, but it's worth discussing with your provider the risks and benefits because normally during labor, they'll give you antibiotics to decrease the risk of that GBS transferring. But the test is valid for about 4 weeks because GBS can increase and decrease in like a 4-week cycle. So that's why they test around 37 to 38 weeks because again, 28% of people are having their baby between 37 and 38 weeks. Most of us are having our babies at like 40 to 41 weeks. So then they don't have to retest you because they used to test people at 35, 36 weeks. And then they just had to retest people at 39 weeks when they still were pregnant. So this decreases the number of times that they have to do the test. But other than the GBS test, as well as maybe some big emotions that you're experiencing, it should pretty much be the same as like the rest of your pregnancy in the 37th week. But Gina, how are you feeling?
So we have finally entered the any moment now phase, which means that I am assessing every Braxton Hicks and cramp and maybe contraction to determine whether or not it's going to progress into anything. And I will do this until this baby is born.
For the next 4 weeks.
Probably 41 weeks. So It's a long period of time to be in this like weird limbo. And so mentally, it can be a little overwhelming because you're like thinking about, well, what can I plan to do versus like, should I just be waiting around? And so it's like, well, I want to do this thing with my daughter, but maybe we'll have a baby and I can't do it. And so figuring out backup plans for different like plans and stuff that we've established as well. But this weird limbo is very hard for me. Like every pregnancy, somebody asks me like how I mentally handle it, and I'm like, not well. I don't deal with it well. So I will probably text my midwife and Roxanne multiple times to say I feel something for it to be nothing. And I think deep down I always know that it's maybe not anything.
But who knows, maybe
But you never know. You never know.
You'll be denial.
When I am in labor, though, I am like, oh, this is it. And so I'm kind of waiting for that feeling. But then I still, every time, will be like, well, maybe it's different this time. And then ends up not being. I mean, it ends up being exactly the same. But you never know. You never know. So right now we have
2020.
Yeah. So right now we have a tropical storm that's coming through. So I'm having a lot of Braxton Hicks and cramping and even contractions coming at like a frequency. They feel similar to like a labor contraction, but like not quite the same. But they're coming at a frequency. And so it's like, is this it? Or am I just going to be uncomfortable until the weather clears up? So we will see.
Will there be a week 38?
Will there be a week 38? Likely, yes. There will probably be a week 41.
See you next.
But you never know. We have been trying to figure out what are we going to do if I do go into labor, and we still have weeks to do. Roxanne will just do them by herself.
We'll have baby with us.
So I did have my GBS test a few weeks ago, so I will probably be outside of my 4-week window by the time I give birth, unless I give birth this week, and then I'll be good. But it was negative. But some things that I consider when it comes to whether or not I would want antibiotics during labor is whether or not my water has been broken, because I think that increases your risk of GBS infection for baby. So these are just like different conversations that I've had with my midwife on like, what do I want during my birth? And we kind of went over like different risk factors and which ones would we want to like be a little bit more cautious of versus others. And so it can be a really good conversation to have with your provider if you are trying to figure out like, well, what should I do if I'm GBS positive? I'm fortunately negative, so it was kind of a non-issue at that point. But she and I did have a conversation on like what I would want during labor if I was GBS positive and what risk factors we were willing to accept for it. At this point, our house is pretty much ready to go for baby. I did have somebody message like, how am I maintaining my house between the time that I deep clean it to when baby is born? Because they're like, I cannot.
You're just constantly
like,
deep cleaning.
Constantly cleaning. And so what I have done is I have my space that I plan to labor in fairly organized, and I try to focus on maintaining that. So instead of focusing on the whole house, I just focus on the one room that I will primarily be laboring in and keeping that organized and keeping all the things that I need for my labor like ready to go there, because it's just so much more accessible than trying to like keep the entire house clean with 3 small children and a husband.
And a husband.
And a husband.
Cooks massive meals in the kitchen.
Very messy chef. Now, if I do have to transfer for whatever reason, and one of the stressful parts about transitioning from like a home birth to a hospital birth is getting all your stuff put together. And so like whenever I've supported transfers, like we're kind of running around the house trying to figure out like what somebody would want at the hospital. And so we're like finding sandals and where's your underwear? And we're kind of throwing things in a bag. And so what I have set up right now is I don't have all the stuff in bags, but I have them in bins. And so essentially if I did need to transfer, Roxanne could just run in the bathroom, grab my postpartum bin, throw that in a suitcase. She can then run into like my breastfeeding basket and just throw that. And if I have a bunch of extra stuff, it's okay. But everything's pretty much organized to where this is what I want immediately postpartum. Just take that and throw it in a bag for me. And I'll probably have a bag just set aside just in case I need it with clothes and stuff. But all of the things that I plan to use immediately postpartum will be readily available if we do need a transfer for whatever reason. The other thing that I'm thinking about right now as well is like who I want at my birth, because you get to pick whoever you want to be there or not be there. And
Roxanne's kicked out.
Roxanne, you did not make the cut. So good things to ask like your provider is to know what number of people you can have if you're giving birth at a hospital or even at a birth center. Anywhere outside your home, it's good to know like what your number is Some hospitals have a little bit more restrictions with like who can be there, like number wise. Obviously, at home, you can have as many people or as little people as you want, and same for a hospital or out of home birth. For me, when it comes to planning to give birth at home, obviously I want my partner to be there. He's number one on my list. We chose to make a baby together. I guess he should be there. And then I'm thinking about like my secondary main support person, which could be like a doula for you. For me is Roxanne. If you have like family members that you want to be there to support you, like making sure that they're on board and that they're available would be really good. So we'll also have my mom there as well at the birth. Her primary task will be like taking care of my older children, but she'll also kind of pop in and out to like help with labor support and stuff as well. Obviously, I'll have my midwife and her birth assistant, and then we do have a photographer who's like another doula that'll be coming as well. And then that'll probably be kind of it for me at the birth. But figure out like who you want at your birth that you think is going to be really supportive and not increasing anxiety can be really helpful as well. And then having something established with your partner of, I want this person to leave. Like, I thought I wanted them here, but actually I don't anymore, can be really helpful too. So like a code word or like having something figured out where it's like, I need some space from people.
Tell Roxanne to leave.
So that could also be something that's really helpful to do, because you may think that you want somebody there and then realize that you don't want them there, and vice versa, where you're like, oh, I really wish this person was here and help support me during my birth. But I do really think having a second support person is really helpful, especially for our partners, because labor support is really fatiguing.
And they have to go to the bathroom sometimes.
Yeah.
They need to eat. Like, they can't only squeeze your hips for 12 to 16 hours, 24 hours.
So yeah, that's pretty much how I'm feeling right now. 37 weeks, lots of cramping and Braxton Hicks because of the storm that's coming through. So it's very confusing what is happening. So lots of text messages getting sent to Roxanne and my midwife on maybe this is it. I don't know. I'll let you know if it progresses, and it doesn't. It doesn't progress.
But I'm sure your Nancy prefers you to text her and it be nothing than you to not text her and then be like, and I'm pushing.
And the baby is born.
So don't be afraid to text your providers, your doulas, whoever your birth support is.
We'd rather know just so we can be ready just in case. But yeah, so in this weird limbo now, any moment now, this baby could be born. Likely not in a near moment, but you never know. You never know. They do come whenever they feel like. So thank you so much for watching week 37 of our pregnancy week by week update. Hopefully you are doing better mentally than I am in this weird limbo. Let me know what you are doing to help distract yourself, or if you're experiencing any signs of labor, like how you knew it was labor, because maybe it'll help me kind of figure out what is going on as well. You would think that I would be experienced now as a fourth-time mom. I'm not. I have no idea what's going on either. If you want more support throughout your pregnancy, we're at the very end. So you might not need a whole ton of our prenatal support, but we do have some third trimester specific options. We have our Pellet4 Prep for Birth course, which includes mobility flows. If you want to incorporate some movement at the very end of your pregnancy, this could be super beneficial to helping you prepare the Pellet4 for birth, which is a lot of what I'm starting to focus on now as well during the very end of my pregnancy. We also have our condensed childbirth education course. If you're like, I forgot to take a course, I need to do something, you can jump onto that course. It's about half the length of our full course. Goes over specifically like what to expect during labor, laboring positions, comfort measures, pushing. And then we could also start thinking about the postpartum as well. So we do have a postpartum prep course to help you understand what is going on after you give birth, and a newborn care course. And this newborn care course includes what to expect with baby with the first month of life, in addition to infant CPR and infant massage as well. You can check out all of our courses on our website at mamastayfit.com and use code YouTube10 to get 10% off any of our online offerings.